Welcome to the video on history taking in communication. As medical students as well as doctors, we will encounter a number of occasions where we have to take histories from children and their parents, and they present with a number of problems. And we all know the structured approach to taking a history, starting from exploring the presenting complaint and its background and the components of other histories like allergy, diet, immunization, surgical history, family history, and past medical history and the social history. However, we have to learn the correct way of communication so that the patient will feel more comforted. And in this demonstration, we are going to demonstrate a scenario where a doctor is going to take a history from the patient, and we follow the approach explained by the Calgary-Cambridge communication model. It is very important to have a good rapport with the patient before we start the proper conversation where you gather specific history. So how can we start? How can we begin a conversation? So in this phase, you need to welcome the patient, you have to introduce yourself. It is recommended to ask an opening question. What is the better way of asking questions from a child or the parent? Perhaps you may think that it is important to pay more attention on the medical point of view and then asking questions based on your aim to arrive at the final diagnosis and the management. But patient's perspective sometimes can be different. Therefore, when you try to explore the history, first it's important to gather enough knowledge about the number of problems the patient is presenting with. And then it is very important, after you come to know the problems, make an agenda. For example, you may want to discuss one problem first and then the second problem as the second step and another problem as a third step, and then agree with the patient about the sequence of your consultation. And we call this a collaborative agenda. So what is meant by an opening question? So it is actually helpful to build up a good rapport with the patient. And this question may not be directly relevant to the matter the patient presented with. And next, we have to start asking questions, but initially we have to give enough opportunities for the patient to speak. Their active listening is very important. And the questions are projected from open to close-ended style so that initially the patient is given enough space to speak, and then we can verify and then gather more information which are specific and important to making a management plan by asking specific questions. So that is your beginning of the conversation as well as the body of the conversation. And lastly, it is very important to explore the patient's perspective. For example, asking about patients' ideas, beliefs, expectations about their own problem, which is somewhat different, or which may be somewhat different to the biomedical perspective or what the doctor believes. It is very important that you explore the patient's perspective, because that approach has been shown to be more effective and be associated with higher levels of patient satisfaction in doctor-patient communications and consultations. So let's watch this video on taking a history based on the principles of the Calgary-Cambridge communication model.
Good morning, doctor.
Good morning. Please take a seat.
Thank you, doctor.
So, good morning. And I'm Dr. Aisha, and I'm the doctor who is looking after your baby Lakindu. So, am I speaking to Mrs. Minoli Senapati, baby Lakindu's mother?
Yes.
Nice to meet you.
Nice to meet you.
So, how are you doing? Is everything okay?
Actually, doctor, we are very worried these days because he's falling sick and he's always crying. We are really worried about this.
Right. Then you were staying with Lakindu, isn't it?
Yes.
Are you doing a job, or are you a housewife? What are you doing as a profession?
I'm a housewife.
Oh, that's nice. It means you have more time to spend with Lakindu, is it?
Yes.
Yeah.
Yes.
So can you explain a little bit more about Lakindu, what has happened to him and what's wrong with him?
Actually, doctor, we don't know what has happened to him, but all throughout the day yesterday, he was holding his tummy and he was crying, and we also can't console him. So we don't know what has happened.
Why he was crying? Did he say anything regarding that?
I think he was holding around his belly button.
Mhm.
I think the pain. I think he's having a pain
Uh-huh.
somewhere over there,
Right.
and also he vomited also. So we are a little bit worried about this.
You mean Lakindu is having kind of tummy pain associated with vomiting?
Yes.
Right.
Yes, doctor.
So what else are you worried about? Is there anything else?
Actually, last night he was having a fever also. But then we gave him Panadol, and then he was okay.
Right. So little Lakindu was having a tummy pain, which was around belly button,
Yes.
and vomiting 2 times associated with fever.
Yes.
So shall we talk about it more in the order of first as the tummy pain, then next about the vomiting, and thereafter about the fever? Does it sounds good?
Yes.
Okay. Then can you explain a little bit more about the tummy pain? How was it? Was Lakindu unable to sleep as well with the tummy pain?
Yes, actually, he was, as I told before, he was holding his around his belly button, and he was lying on bed and he was crying. And then after a while, he was exhausted, and then he fell asleep. That kept on happening yesterday, over and over.
Kind of severe pain.
Yes.
Right. So how was his toileting and passing of urine? Was it normal or any abnormality?
Yes, I didn't notice anything out of the ordinary. It was normal, just the vomiting that was a bit worrying.
Yeah, it means mainly the tummy pain was around the belly button, which was not elsewhere, and also with normal toileting and passing of urine. So you told me that he has vomited 2 times.
Yes.
How was it?
Actually, he vomited once in the afternoon, and then again in the evening he vomited.
Was it like blood stained or any greenish color like that?
No, he just vomited what he ate.
All of the food particles,
Yes.
right? Okay. Then apart from the tummy pain, vomiting, and you told me that he was having fever.
Yes.
So what about it? Have you measured the fever?
Actually, we don't have anything to measure the fever. He was feverish to touch, and because of that, first I think the fever came at around 8 at night, and then I gave him Panadol, and then he fell asleep because he was tired, I think. But afterwards, at around 2 a.m., I think he again started crying, and he was feverish.
Kind of
yes.
intermittent in nature. So how much of Panadol did you give according to the weight or how?
Actually, I'm not familiar with this, but I did it as it was in the manual in that box.
Yeah, that's good.
Yeah.
Right. So Lakindu had tummy pain, which was mainly around the belly button area and not else anywhere, and which is associated with vomiting, and has had intermittent kind of fever, which has responded to Panadol,
Yes.
isn't it? So, is there anything else? Does he have any other previous medical conditions or
No, he is a
allergies
very
as well?
active child. He doesn't have. We don't have any problems regarding his health.
Has he consumed any food from outside in
Yes,
the
doctor.
previous
Actually,
days?
that's why we are really worried, because I am very adamant about what I give him, and I always cook his meals, and I am a really clean person when it comes to preparing food. So that's why I'm worried why he got this tummy pain.
Yeah. So, is there anything are you concerned about? Any worrying thing?
Actually, my mother's uncle, he fell sick, and he was diagnosed with a colon cancer. And I've heard that these cancers are genetic, and I'm scared maybe my son is having any sort of problem like that.
So, what happened to him, your uncle, mother's uncle?
Actually, he passed away a few years back.
I'm really sorry to hear that. So you're also thinking that little Akindu is also having the same problem, isn't
Yes,
it?
I'm worried about it.
So what do you expect to know?
Actually, I would be really grateful if I could find out that this is not something sinister like this, and I just want him to be healthy as soon as possible.
Yeah, that I just need to tell you that having a cancer in this kind of age, I mean a colon cancer, is very unlikely. But since your baby is having fever for 3 days, we can proceed with doing a blood test to check whether there's an infection and whether it's a viral or bacterial kind of infection. So for the time being, we are controlling his vomiting and fever with medicines, and you don't have to worry about that. So once the test results are available, I will let you know about that. And also then after that, we'll arrange another chat about to discuss what to do next. So is there anything that you want to know from me or anything to clarify?
No, doctor, I think I feel more reassured after talking
Yeah.
to you.
So, in summary, your baby was having a tummy pain mainly, which is around the belly button area,
Yes.
and with normal toileting and passing of urine. Then vomited 2 times, and also having an intermittent kind of fever, which was responding to paracetamol. Is it?
Yes.
So, let's talk about the further management in another chat. So, thank you.
Yes. Thank you, doctor.